Okay, so Archie and Rick, you are both unmuted.
Okay. Want to convene this emergency meeting of the West Newbury Board of Selectmen on Wednesday, March 18th at 4:02 p.m. In accordance with the provisions of Mass General Law, Chapter 38, Section 20, the Board of Selectmen is meeting in emergency session to discuss issues pertaining to the COVID-19 crisis. And first off, I want to say thank you all for listening in. We want to get as much information out to everybody as possible. I want to thank all our employees for really putting in marathon hours, working really hard on this situation that the entire world is being turned upside down, and everybody is really chipping in, and we're doing the best to handle these situations where things literally change, not even day to day, but within 4 hours a new development occurs. So having said that, we want to discuss the workings of the town hall. The board has made some changes to our policies that we created just on Sunday. We're all in agreement with all of them. So I will let Angus was taking notes. So I will let him lead off with what we came up with just a few minutes ago.
Okay, my understanding of the board's objective, and obviously you can correct me if I'm wrong or missed something, but for non-essential personnel to be basically sent home effective the end of the workday today, or basically effective immediately. That everyone will be made whole in terms of pay for all scheduled time. People would not be using sick time. That would include people who are self-quarantining or staying away because of concern about either their potential exposure or members of their households' potential exposure. The board would like all employees to be treated the same way, full-time, part-time, uniform kind of policy for everybody.
In non-union.
Yeah,
you didn't say
not union, non-union, part-time, full-time. We have prepared some draft policy. Mike and I did, and Stephanie, we've done a bunch of work on that, but we think it's a good start, but we think a little more time will help. So I'm going to be asking the board to make a motion or some motions that set out your broad policy objectives and authorize my office, working with legal counsel, to firm up some of the details so we can circulate some written policy and everyone knows exactly what we're talking about. But in the meantime, I think these immediate actions will help quite a bit. Let me just see. There's something. Why don't we
So basically,
proceed with that before we get to? There was also a specific thing on the first responders, so we'll get.
But hold on. One thing you left out was that this would go into effect at end of business today, which is 4:30, and it will go. We'll readdress this. It will go through next Friday, whatever date that is, and then we will readdress this.
Glenn, and we will revisit that before next Friday.
Correct, but these policies, it's definitely by next Friday that everybody is going to be working from home on non-essential personnel, and that they will be made whole. They will get paid. They do not have to use their sick time, and we're treating everybody the exact same if you're a union, non-union, or a part-time personnel. Everybody gets treated the same.
Friday the 27th.
Yeah. So this will go into effect end of business today, which is the 18th, and to Friday, March 27th, and we will revisit obviously before then to see if we need to end it or we need to prolong it.
Glenn, why don't we revisit this a week from today?
Is that okay with everybody? Mm-hmm. Okay with me?
That's fine.
Today or Thursday, it doesn't matter to me. Because it goes into effect Monday, so if we had everybody come back to work, it would be Monday, and they would have a couple of days anyways over the weekend to get ready, but Wednesday is fine. And we'll set up a time later on in the week.
If we feel we need to adjust anything, that'll give us a couple of days of working experience with it, or a few days of working experience and a couple of days to adopt anything.
So I'd like to make a motion to that effect, that at the end of business today, which is at 4:30, that all non-essential personnel will be working from home, that we will be paying them, they will not have to use sick time, and everybody will be treated the exact same if you're a part-time, full-time, union, or non-union personnel. And then the motion will, today, and then we'll end March 27th.
Do we have a second?
A second. Yeah.
Further discussion?
Did you hear my second?
Yes. Rick seconded.
All in favor?
Aye.
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 Now, one thing, and I didn't want to interrupt Archie, and I was good, Angus. Who's making the determination again on non-essential and essential? We forgot to talk about that during the discussion portion of it.
Right, I mean, that's, department heads have been asked, but that just went out earlier today, so I've gotten a number of feedback, response emails, haven't even had time to open most of them. So that's gonna take some, I think my recommendation would be in the immediate term, if people want to stay home,
If they're essential or not.
before that determination has been made, because I think just even over the next 24 to 36 hours, I'll have a little more breathing room in terms of the department heads. I think the initial presumption would be all department heads are essential, non-department heads perhaps not, but that's, I don't want to generalize, we got to get into the specifics, but I think in the immediate term, anyone who feels that they are
Always.
comfortable being at the office shouldn't be at the office. No
And what
question.
happens if
I
somebody is
agree with that.
deemed,
I
if
think-
somebody is deemed essential,
Until we get organized with it, they can self-identify.
if somebody is deemed essential, but they don't feel like they should come in, how are we handling that?
Wait, can
Case
you,
by case basis?
Case, but
wait,
if somebody is deemed essential,
yep.
and they say, well, yes, I'm deemed essential, so that means I'm supposed to report to work, but
Right.
I don't feel comfortable doing that.
Yeah.
I think we need to have an answer for that, because that's probably, whoever's listening on there is probably gonna ask us that question when we have the question and answer period.
That's right, we do have in some of the draft policy, which we're not specifically putting for the board to vote because we want more time to work out the details. But some of the provisions in here for work from home would provide, the employees acknowledging their availability by telephone, email, and/or remote during regularly scheduled hours. Specific method or methods of availability determined with your supervisor, with the town responsible to ensure that the employee has access to the technology, training, and support for such method or methods. So I think for essential personnel, I think where we're going with this would be they'd be working remotely, and we would set up provisions for them to have full access to what they need to do their job. There are some things that have to be done here, and we'll work that out. And there are some of us who will be here physically, so that'll be
Okay.
worked out.
Anything else and then I'd like to make a motion that on page 13 of our open session packet, page 13 of our open session packet, correct?
12.
12.
Starts
Starts at 12. Okay, that the Town of West Newbury short-term telecommuter agreement, that we would give Angus the authority to work out the details. We have read it, and have him just work out the details, but not changing basically the substance of it, and just give him that authority to. He doesn't have to come back to us for approval. I think we all understand, it's kind of a good outline. I don't think it's gonna change much, but I think he's just gonna wanna dot some i's and cross some t's to make sure
That's right.
that it really works for us. That was a motion, by the way.
Second.
I'll second it. Oh,
Okay, so let Rick second it. I just make the comments like what I said a little bit earlier, that, you know, we have to hammer out some details about not taking home original documents that might not be replaceable, that kind of thing. But yes, I agree to let Angus hammer out the details.
Okay?
All in favor?
Aye.
Aye.
Parker, aye.
So what else, any other votes do we need to take today, or a discussion?
Well, let's talk about our fire department policy.
Okay, fire department policy?
So on discussion with Chief Dwyer, we obviously call fire department is a completely different situation, even from part-time employees, and quite often they are going to be the people that might be encountering exposure to the virus. So individuals may be exposed on the job site and be told not to report to work, or they may feel uncomfortable bringing said infection back to their house, expose other people in that fashion. So we would develop a plan that on an average of 2 months or 6 months of past performance of an individual call firefighter, on average, how many calls in that month did they arrive at before the virus situation, and going forward, if they did not feel comfortable answering calls or were not allowed to make calls, we would reimburse them, or we would pay them for the percentage of calls that they would, on average, had been making in the immediate months preceding that.
One thing, before discussion goes on, I just want to note, we had some additional people call in, and so I just want to say, the callers at this point are on mute. The board is going to open for public comment, and everyone will be provided an opportunity to speak. But for right now, it's the public comment hasn't opened yet. So if you're on the call, you will be given an opportunity to speak if you choose.
Any further comments on that? Did I get that all right?
You got it. Just in case, you want me to kind of summarize it? Just in case somebody didn't hear that, or can they probably hear it? I'm not sure how well they can hear through, but that if someone is deemed or asked to stay home by their department head or the fire chief or the board of fire engineers because they've been exposed or potentially could be exposed to this COVID virus, that they would still, they've been asked by the town to stay home. We would go back 6 months, get what their percentage of call rate was, and then even though they're staying home, they would then be given that percentage in pay for any calls that there might be no calls, so they wouldn't get anything, or there could be 100 calls, who knows, but they would get that percentage of pay for the period they were asked to quarantine.
One clarification, I think what I heard Archie say is that would also include people who, not just those sent home, but also those who don't feel safe responding to calls either because of their or a household member's.
Because they're a person at risk.
They're a person at risk.
Either
Right.
they're or a member of the household
Is a person at risk.
Right.
Fine.
Okay, do we want to make a motion on that, somebody?
Well, yeah, I'll move it as described. I probably won't try to repeat the entire,
Okay,
but we've repeated it twice already.
Yep.
yeah.
So what I said with the addendum of what Angus said would be my motion. So I move that.
Okay.
I'll second.
All in favor?
Aye.
Aye.
I think that's all we.
And the one caveat with that is this would, we want to make it clear that this is a, this is not a, long-term change in the way call firefighters would be paid. This is relative to this situation, and it's not necessarily gonna be happening a year from now.
Yeah, it's not a policy that's going to go forward. As soon as the crisis is, whomever deems this COVID virus done.
Well, and with the board's adoption of the
Yeah.
local declaration, that's a good
Yeah.
milestone, because at some point, the board would be voting to lift that emergency declaration. So
Good, that's a great point.
That's correct.
Okay, anything else? I think we should try to keep it as simple as possible, especially since we're doing it remote and people might have questions. It's just a,
So I would ask that people. So Angus, how are you going to recognize who has a question?
Well, so right now I can, so right now we have 1, 2, 3, 4, 5, 6, 7, 8 callers. I could either unmute everybody, or I could unmute one at a time and ask them individually if they have question or comment. What we're trying to do here is manage the technical side.
Why don't you do, if there's only 8, I would say.
I would do one at a time.
Either go one through 8 and just ask each person.
Okay.
Because everybody can hear everybody else's response.
Yes.
They can hear what's going on. They just can't say anything. So I would do it, and I would ask for them to identify themselves.
Okay. Caller 11. Well, of course you don't know your caller 11.
Oh.
They don't know their caller 11.
If
what?
caller 11 speaks up and hears their voice, they know they're on.
Well, but there's 8 of them. That's going to take a while.
Okay.
I'm going to unmute everyone and just, so one at a time. And the chair will recognize whoever speaks up first. So just say your name.
Hi.
Who?
Chief Durand.
Okay, Chief, you're on.
He's caller 11.
No questions.
Thank you.
This is Corinne at the library. I have one question.
Go for it.
She's
Regarding the new policy around sick leave, does that include people who were in self-quarantine prior to today? Meaning, will they have to use sick leave for that time, or would this policy cover their self-quarantine in the last week or so?
How many? What are we talking about, Kurt? Well, how many people and what are we talking about?
I had 2 staff members out this week, yesterday and today, both with symptoms that they were concerned about.
I would say my personal opinion would be that they would be covered.
Okay.
I would think that it's not a big issue if
Anything from this week, I would
I
say.
can see it's retroactive is okay.
Yeah, the governor's declaration was last Tuesday, so the 10th is also a good milestone to use.
Okay, thank you.
Hold on. It's a good one to use, or are we going to use
Well,
it?
that's
So that's
a suggestion.
before anybody says okay. I want to make sure,
Yep.
if nothing else, that we're clear.
Yep.
So do we want to use the 10th or of next week, last week, or do we want to use this Monday?
I couldn't hear Glenn's question.
His question was whether, in terms of retroactive, whether we want to use March 10th as the milestone instead of the local declaration on March 16th.
16th. I would say 16th.
I don't know. I hadn't thought about that.
Corinne, your question for your employees, if we said that it would be retroactive to our declaration made on the 16th, would that make them whole and not have to use sick time?
Yes, because they started, they were out for the 16th, or the 17th and the 18th, rather.
So I say we should make it retroactive back to our declaration on the 16th, so then, Corinne, your people would be made whole.
Thank you.
I agree.
Chief Durand again. I had some people that were told not to come in by the Board of Health prior to the 16th.
You were, okay.
Okay, what date is that?
Would be a date.
Do you have the dates?
Go again?
Do you have the dates?
Yep.
Well,
Could you give them to us?
was that even before the 10th or not?
I'm looking here. I have one on the 13th and another 15th.
Okay. Does anybody, before we start making another motion and then somebody else has another individual, does anybody else have anybody else that goes back further than the 13th of March?
No. No.
So then I would make my motion.
Angus, can you hear me? Glenn, hold on a second. Angus, can you hear me?
I can hear you,
According
yep.
to my screen, 3 of the callers are not active. No, 3 of the callers 17, 19, and 16, are not shown as being active.
Okay, they're showing up on
They may not be
mine.
able to be heard right now.
Everyone's unmuted.
Okay, all right,
Yep.
got it.
Yep.
With the only comment to that, everybody, is we don't, we're assuming that everybody is in on this meeting, and we don't know that.
So why don't we go back to the declaration on the 10th that the governor had?
Let's use the 10th as the day, yeah.
Yeah. Okay. I'll make a motion that anyone who self-quarantine or asked to stay home in relation only to this virus, that they would be made whole and not have to use the sick time and retroactive back to March 10th.
I'll second that.
Okay, further discussion? All in favor?
Aye.
Aye.
Okay, 3-0-0.
Oh, God.
Does anybody have any other questions? And remember that when you're on these conference calls, we can hear people in the background.
This is Annie Sterling.
Hi, Annie.
Hi. I don't have a question. I just wanted to say I appreciate what you're doing.
Thank you.
Thank you, Annie. We appreciate what you and everyone else is doing.
Thanks, Annie.
Unless anybody else has any questions, I'm going to make a motion to adjourn.
Oh, we do have some minutes just from the other day I'd like to post, because just the emergency meeting from 2 days ago, just so we can post them, so.
Does anybody
But in
have any
terms
more
of-
questions?
In terms of the public comment section, we could mute people unless there's further comment. Leanne, did you have anything? Or Chief Dwyer? Or Paul?
No, this is Leanne. I'm okay. I just say for future conference calls, if we do it like this, when you take everyone off, we do ask them to put their individual phone on mute until they want to speak.
Got it.
What did she say? I didn't hear.
She's saying, for future calls like this, to remind people when we take them off mute that they should mute their own phone unless they're actively speaking, to cut down on the background noise. So
Thank you.
If Leanne is there, I would just like to ask her, Leanne, I was getting ready for this, so I wasn't able to look at the MEMA, listen to the MEMA thing today. Was there anything that we should know about?
No, I'm waiting for the updates to come out now. Region 1, our local MEMA office, is going to start holding conference calls for EMDs only on Tuesday and Thursday at 1 p.m. So if everybody just keeps that in mind, if you have any specific needs or questions, funnel them to me and I will bring them up on those conference calls, and of course report back afterwards of anything that you need to be updated on.
terrific.
Okay.
What's the date?
Okay.
I have just one last question too. I think 2 of the callers haven't been identified, and if they want to identify themselves, can they do that at this point? I can't see that they're active. Just if you could.
Stephanie Frontiera, Town Accountant, Business Manager.
Thank you.
Fred Shinanya, Library Board of Trustees.
Hi, Fred.
Thank you.
I'd like to make a motion to approve the minutes of our emergency meeting that was held on what?
Sunday morning.
Sunday morning.
Sunday the 15th.
15th, yep.
I need a second for one of you two.
No, second. Second.
All in favor?
Aye.
Aye.
Make a motion to adjourn.
A second.
All in favor?
Aye.
Aye.
Thanks, everyone.
Thank you.